And we're recording.
Okay, so I do want to go ahead and introduce myself. Hey y'all, my name is Orica. I am the Executive Director of the Student Wellness Advisory Board, and this is our first event of the semester, which is the vaccination forum. So I'm gonna go ahead and introduce our speaker. So our guest speaker is Dr. Ashley K. Brown, MPH. Dr. Ashley Brown, a native of Jackson, Mississippi, is a graduate of the University of Southern Mississippi with both an undergraduate degree in biological sciences and a master's in public health. Both degrees led her to her dream job at St. Jude Children's Research Hospital as a clinical research associate with the degree of hematology. Working alongside physician sciences enabled her to pursue a career in medicine, where she then attended the University of Mississippi School of Medicine. Through medical school, she advocated for diversity in medicine by co-founding Black Representation in Medicine, BREM, to increase minority presence in professional schools. Upon graduating from medical school in 2020, Dr. Brown continues on a physician's research track, working with the Department of Hematology. Dr. Brown aspires to specialize in hematology research with a focus on sickle cell anemia and bone marrow transplant. Okay, so sure. Oh,
I love a good introduction, especially when it's by yourself sometimes.
so can y'all see the PowerPoint? Can y'all see the PowerPoint?
Yes, we got we just see it in
Okay.
you know the
Oh, yeah.
We started slideshow from the beginning. There are a couple animations just to keep me going. All right, so I guess it's okay for me to get started. Should we wait a couple minutes? I'm okay with that too.
we can go for it. Dr. Brown.
All right, COVID-19 vaccines, the more you know. And I chose the more you know because I don't know if y'all watch NBC, those commercials, the more you know. So this is just to add on to some of that information that I'm sure a lot of people have heard in the news and throughout healthcare and everywhere. So this talk is definitely going to be from the CDC and the World Health Organization. All of this is referenced through them. And you can click to the next one. I am a firm believer in pictures say 1,000 words. So before we get started on vaccines, I have to kind of take it back a little bit and just make sure that everyone is on the same page on what a vaccine is and how we get to the point where we are now. So our defense system, so you have two aspects of it. You have the adaptive, which is what was within, which is how our body determines things from a molecular point of view. And then you have innate, which is our body's natural defenses that we don't really think about. So your eyes, when your eyes water, getting some in your eye. When you cough, to get something out of your throat, your skin, sweat, all of that is things on our body that we don't think about. But the adaptive process is where the vaccines come into play. So adaptive is how our body is introduced to certain pathogens and our response. And that response kind of grows to a bigger response later. So when I say non-specific, that's more bacterial. So that's things in regards to antibiotics that, you know, we've learned what affects. Penicillin, we know, is great at fighting infection. So that's a non-specific. But when you talk vaccines, you're talking very specific. So when we think about, I try to always use the chickenpox example. So chickenpox is caused by varicella, which is a virus. But varicella is very specific in regards to it causes the same thing in everybody. You get chickenpox, then it itches, you get scaly rash. So the point of the vaccine for chickenpox is to specifically activate our immune system to chickenpox. So you create these memory cells and these cells remember it. So the vaccine is given and it allows your body to know, okay, this is something foreign. I'm going to create a cell for that. So that by the time the child does get the true varicella chickenpox, whether they catch it from someone in class or they get it within their own cells, that immune response is now ready because your body actively remembers it. So that's where I wanted to kind of get the basics before we move on to the next aspect of vaccines. You can go to the next slide. So now this picture shows in exactly how does a vaccine work. So like I said, when it comes to varicella, so a kid is infected with varicella, but at the same time, their body's already seen it because they've gotten a shot. And that shot gave them what we call antibodies to later remember and attack that varicella virus. So this is what we say when a vaccine is given. You're not giving someone a virus, you're giving them something to create antibodies against a virus so that when the virus actually does hit, it causes your body to remember it. So now we're going to get to the specifics. You can go to the next one. So there are 3 different types of COVID-19 vaccines. The first one's Pfizer. Pfizer is approved for 12 years and older. It recently just got approved for the 12 to 16 age group. It is a 2-shot series. It is 21 days apart, so about 3 weeks, and then you are fully vaccinated 2 weeks after your second shot. The next one is going to be the Moderna vaccine. That one is for 18 years and older. It as well is a 2-shot series. This one, however, is 28 days apart, so about 4 weeks. And again, you are fully vaccinated 2 weeks after your second shot. Then the last one is the Johnson & Johnson. This one is 18 years and older as well, but unlike the first 2, this one is a 1-shot series. So it does not require you to have 2 shots. And again, you are fully vaccinated 2 weeks after your single dose shot. Now, it's going to flash the Pfizer and Moderna because Johnson & Johnson within the last couple of weeks to months has had some controversial adverse effects. And when we say adverse effects, we mean serious complications that require the FDA to kind of go back and look at some things. So you may have heard Johnson & Johnson was causing blood clots in some people, as well as some people were reporting inadvertent bleeding in places. So the rest of my talk, I'm going to kind of dedicate it to more the Pfizer and Moderna, just because Johnson & Johnson, with it being a 1-shot, it's just on a different spectrum. And it's actually not as popularly used in some of your healthcare institutions and the physician offices as Pfizer and Moderna. So when we go through the rest of this talk, just keep in mind, majority of what I'm focusing on is on those 2. So first up, Pfizer. So Pfizer is probably your most common in regards to everyone who's vaccinated. It's probably going to be closer to 50% of all vaccines are Pfizer. It's 95% effective against COVID, and that effectiveness does have to be after both shots. So again, that 2 weeks after the second shot. Like I said, it was recently approved down to the age of 12, and we expect that to get even lower within the next couple of weeks to months, actually. It is given in intramuscular and upper arm. The side effects, just like all side effects at some injection sites, a little bleeding, they give you a Band-Aid, maybe some pain, some swelling. Some people report they can't sleep on that arm that night, or maybe feel heavy, which is very common in most of your vaccines. And then your other side effects are kind of that, what people call that flu-like illness that they report within 24 to 48 hours. So tiredness, headaches, chills, fever, nausea, things that you expect, because again, we're talking about your body building that immune response to the vaccine, so that if the virus does come, you need to be ready for it. And the new news is the booster shot. And the booster shot is only for the Pfizer vaccine, and it's given to moderately to severely immunocompromised individuals. So your people, maybe cancer patients, long-term care facility residents, so people living in nursing homes, senior resident homes, and then all of your frontline essential workers. And I like to preface that and say that frontline doesn't always mean healthcare. We're talking your teachers, your postal service people, people who work in your grocery stores, and your restaurant workers. Those are all people, if you've had the first 2, you can get a booster shot. And that booster shot is given within 6 months of your second dose. So we can go to the next one. So the next one's Moderna. And again, like I said, this is the second most common vaccine that's given in regards to COVID. It's about 94% effective against COVID. Again, that's after 2 weeks after your second dose. It's given in the upper arm as well, intramuscularly, and the same side effects. The big difference here is with Moderna right now, there is no booster shot. So if you did receive the Moderna series, right now there is no booster shot that's available yet. There is talk of the works of maybe that one requiring one, but that's still kind of up in the air. And then I did do Johnson & Johnson just for clarity for the next one, just to kind of talk about it as well, at least at this point. So far, it's only about 66% effective against COVID after that single dose. It is, again, given in the upper arm intramuscularly. Side effects are about the same for all of them. However, just mentioning before, those adverse events really caused Johnson & Johnson to kind of be in the news more so. Fainting was reported, there were blood clots that were reported, and then something called thrombocytopenia. And that is where your white blood cells just kind of go a little haywire, and it causes you to have some palpable kind of issues on your skin. You may some redness. It's a little more extreme than just a basic reaction. Not as extreme as anaphylaxis. And anaphylaxis, that's where you have a true allergic reaction. And if you have any anaphylaxis after receiving the first dose of any of the vaccine series, then you actually are told not to get the second one. And then when I say anaphylaxis, I mean can't breathe, throat swell up, kind of like when people say I'm allergic to peanuts and they eat a peanut. This is exactly where it's going. So if you have any of those reactions after the first one, your healthcare provider will tell you not to get the second one. So moving on to the next slide. So after receiving the vaccine, the big question is, so what next? So there's a lot of things in the news that you still have to do even kind of after being vaccinated. So it is safe to resume. I'm sorry, you can go back. My bad. It is safe to resume some of those pre-pandemic activities. So you can go out to eat, you can go to the movies and all that. Travel is still a big question, just because what we do in the United States, it doesn't necessarily mean state to state, and also doesn't mean country to country. So in regards to travel within the United States, now you no longer need to get tested or self-quarantine if you can prove you're fully vaccinated. And then the next big thing is close contact with someone who has COVID-19. So just because you are fully vaccinated, there are things called breakthrough infections. And a lot of those breakthrough infections, you may never even know you're infected unless you get tested or unless you know you were with someone who tested positive. So even if you don't have symptoms, if you have come in close contact with someone who was positive, you are asked to test within 3 to 5 days, just to be sure. And also wearing your mask indoors following the exposure event. And then if need be, you can also isolate for 10 days if you go and get positive and get tested positive. That 10-day thing still applies to you, because at the end of the day, since you're vaccinated, that doesn't stop you from spreading to others. And I think that concept is kind of hard for some people to understand. So next. So kind of where we're going, how do we protect others? So get vaccinated. That's the big thing. We've seen you're in the high 90s just from the Moderna or even the Pfizer vaccine, 90% effective. Wearing a mask, and that I have a slide on that kind of next that we'll discuss. Staying 6 feet apart, just being aware of your surroundings, especially in big groups, avoiding crowds, poorly ventilated spaces. Washing your hands often, that's a big thing. I mean, even as a healthcare worker, I do it so much, but you don't think about how much you do it. Don't do it even when you leave. So now I leave a bottle of hand sanitizer on the side of my door just to make sure I can, after I pump gas, wash my hands. After I walk in the grocery store and touch the grocery cart, wash my hands. Cover your coughs and sneezes, and the mask does that. So that's another reason to wear them as well. And then cleaning and disinfecting. So Lysol, Germex, as you know, that stuff became so hard to find within the first few months of the pandemic, just because everyone was kind of going on a sprint. We can go to the next one. And monitoring your own health. This goes back to that whole, just because you are fully vaccinated does not necessarily mean that you won't have these symptoms or cannot spread that breakthrough infection to others. So just being mindful of, if you feel sick or you have a cold or something like that, just knowing that it's not COVID, making sure by getting tested, which you can do very easily now compared to at the beginning of the pandemic. Next slide. So masks, to wear or not to wear. This is a big debate, huge debate. In my world, everyone has to wear a mask regardless, and majority of the hospitals vaccinated. But it's because we take care of people and we can pass it just like anything else. So right now, the law is, it is required on the whole public transportation. So planes, buses, trains, you have to wear a mask no matter where you are in the United States. And then I like to preface it with, it's not necessarily your protection, it's the protection of others. So for my example, I live in a household where we have a young child who is under the age of 12 that cannot be vaccinated. So for me, wearing a mask outside in public prevents me from bringing something back to him, if that makes sense. So to wear or not to wear, it is, to each its own. We do highly say that if you are not vaccinated, you wear a mask at all times. Other than that, only wear it maybe in public places or places where there will be people of lower immunocompromised status. So clearly, if you come in the hospital, you have to wear a mask. If you go to schools, most likely because your elementary/middle schools aren't fully vaccinated, they're under the age. So those type of things. So to wear or not to wear it, it's a big debate, but at the same time, personal judgment and your comfort level in your household. If you feel comfortable without wearing your mask, then that's totally up to you. But in public places, I would just be mindful. Next slide. So I kind of threw this slide in here because it's kind of important because it kind of leads to where the pandemic is right now. I kind of know this was about vaccines, but I think to understand the vaccines, you kind of have to understand the virus. So the Delta variant is kind of the big thing right now in regards to what is causing the most cases. So it is currently the predominant variant within the United States. It's about 2 times more contagious. And me working in the pediatric side, we've shown it to have quite a very drastic effect on children this time around versus at the beginning of the pandemic, we thought, oh, children are safe, they're not getting it. And then research has shown lately that it's actually causing more severe illness. So I know a lot of states now, a lot of people follow on Instagram or like Twitter, but the health department in Mississippi, they release a slide every day and it shows you the number of cases, how many people are in the hospital, how many are on ventilators, and it always breaks it down on who's vaccinated and who's not. The big question is that we get asked a lot as healthcare workers is how do we know it's a Delta variant? And that's kind of hard. It's really hard to figure that question out. I like to tell people in regards to the pediatric world, we're assuming it's Delta because we know that's what affects kids. In the adult world, you can get tested to kind of see which variant. However, the cost, and at that point, is it going to change anything? No, because you can't treat viruses with an antibiotic. So most of your treatment is what we call symptom relief. So, I'm putting you on a ventilator because I need to give your lungs time to build up. I'm giving you this drug to kind of help you with nausea. So it's like I'm treating your symptoms. I'm not necessarily treating the virus because there's no treatment for viruses, which is another reason why we say get the vaccine. But the Delta variant lately is the predominant cause, and we're seeing new variants pop up all over the United States, and we're just waiting to see, or hopefully waiting not to see, but who knows with the way the pandemic's going, waiting to see, will the Delta variant kind of be knocked off its pedestal and something else arise? And again, that leads to the next question of, is the vaccine helpful for all variants? And we'll get to that kind of towards the end, but that kind of leads to a snowball effect of how we go about what we do daily. And then the last but not least, we've shown that the Delta variant, it's a big concern for unvaccinated. We know for a fact that the vaccines, especially Moderna and Pfizer, have shown to seriously decrease the risk if you were to get the COVID-19 Delta variant and be vaccinated. So all these things I kind of wanted to kind of ramp up and talk about, because if it's okay to talk about the vaccines, but if you don't talk about the things behind them, it kind of doesn't really make sense. So I just didn't really know where to put this slide, but hopefully that answers some of those questions in regards to variants and how we go about it in the healthcare world. And next slide is myths. I love some myths. I get asked questions all the time. Am I microchipped, Dr. Brown? Is this going to give me COVID? So number one, you are not microchipped. The vaccine is literally a shot. If anything, I'm sure they're tracking your Instagram, Facebook posts way more than they're tracking your vaccine status. I'm sorry, I didn't catch that. But altering DNA is another question. In regards to DNA, it doesn't alter your DNA. So going back to those pictures we described, when you give someone a vaccine, it's not your DNA we're focusing on. We're focusing on your cells. We don't want your DNA. Your DNA, that's way too important for us to mess with. So the point is we want to go target those memory cells. So DNA is in nowhere affected from a vaccine. And then the cause variants. Variants pop up because of natural mutations in viruses, and that has nothing to do with the vaccines itself. I will admit sometimes we tend to see that variants pop up after vaccines happen, but that's not, it's just like someone's allergic to penicillin. It's not necessarily because penicillin changed or anything. It's because their bodies naturally produce something to fight penicillin. It's a natural selection process. So no, the variants are not necessarily caused by the vaccine. You start to see more variants after a vaccine, but that would make sense because viruses just got smarter. They realize, okay, well, these people have a vaccine. We need to figure out a way to cause more harm against the vaccine. So that's kind of where that comes from, but there is no cause and effect with that. And next slide. So frequently asked questions. First and foremost, I have a lot of OB friends and they always get this question, can pregnant people get the vaccine? As y'all seen in the news, this has become a really big issue, pleading moms, especially to get the vaccine, pregnant mothers. And they've shown you can get it at any point in your pregnancy, down to once you find out if it's as early as 6 weeks, you are safe to get the vaccine. That's actually become a national recommendation through the American College of Gynecology, which is what we call ACOG in the healthcare world. So yes, so pregnant people should get it. Majority of your OBGYNs, healthcare workers, usually that first prenatal visit, they're now starting to add that to the discussion along with every other vaccine. Did you get varicella as a kid? Did you get rubella as a kid? It's now becoming a common aspect of that. Next question, affect fertility. Studies have shown that it does not affect fertility, but in the grand scheme of things, we never know what affects fertility. Fertility is something that we take vitamins to help our hair and skin and nails, but technically vitamins are not even FDA approved. So we know it doesn't necessarily affect fertility, but in the grand scheme of things, we have to look at it as a whole, that our environment affects fertility. So we're still kind of looking at that, but right now we are saying no, there is no true cause and effect in regards to getting the vaccine and your fertility. Can you get COVID from the vaccine? Going back to that before, no. So the COVID vaccine is not a live virus. This is taking parts and pieces of virus RNA, which viruses don't have DNA, they have RNA. It's taking bits and pieces of their RNA and constructing something so our body will recognize it. This is not giving you COVID by any means. Now, just because you have the COVID vaccine, it does not mean that you can't get COVID. Our hope is that if you get COVID as a vaccinated individual, that it is seriously declines your illness severity. And we've been shown to see that. I think we get these things as physicians daily that say the average person who wasn't vaccinated was in the ICU 11 days. The average person who was vaccinated, hospitals say averages maybe 3 days, and maybe more so because they also had asthma. So we wanted to watch them overnight, or they also had another immunocompromised situation. So a lot of times when you hear those breakthrough COVID positive tests, a lot of times those are either immunocompromised individuals, so they have some second type of underlying disease, which is very common in the South in regards to how many of our patients have diabetes, asthma, just all the things. And then it also means that either they weren't out of their full vaccination window, so that 2 weeks. So like I said before, it takes 2 full weeks after your second dose for you to be considered completely vaccinated. And we've seen a lot of those breakthrough vaccinations happen within that 2-week frame. So you have to remember your body hasn't fully established a full vaccination status. And then we also see that those are individuals who may not have even gotten the second shot. We're starting now at the hospital to keep up with first and second shots. So in our medical record, we are very specific now in regards, like, have you been around someone COVID positive, all those questions that y'all have probably been asked when you go to the doctor, have to sign that sheet that now pops up on every patient. And that just allows us to kind of get a head frame of if you're coming in because you're saying you tested positive, where do we start? We're kind of trying to chase those steps back. And like I said, a lot of those times, either you didn't get your second shot, you were within that 2-week window, so not necessarily fully vaccinated, or there are other aspects behind your medical care that is requiring us to dig a little deeper. And then, can you test positive for COVID after having the vaccine? There are 2 types of tests when you go to get tested for COVID. So you can have a actual viral test, which is testing what we call a viral load. So that test consisted of tickling your brain, going up your nose, and then the new one they have in the mouth. So that's testing viral load. So that's actually telling me right now, are you positive for COVID? That's telling me you are infected with COVID. And then on the other hand, you have antibody test. That test is totally different. So that tells me within your body, did you either have the vaccine or had you had a COVID infection? So antibodies can tell me about, an antibody test tells me about your vaccine status as well as your previous history of COVID. So that is not something that if you were coming and telling me you're sick, we're not getting an antibody test. We're getting a viral test. We need a viral load. So you hear a lot of the terms, the PCR viral load, that is an active, are you COVID positive at this moment? And then antibody test is telling me you had the vaccine, because I'm seeing antibodies that your body has created, or you've had COVID, which again, if you've had COVID, you more than likely the next time you have COVID or the next time you get sick, we will see that, but that doesn't necessarily mean that you always had it from COVID infection. Because if you've had the vaccine, then I would see your antibodies are positive as well. Does that make sense? A lot of people ask in regards to what are you testing for? And I try to explain that. So testing positive for COVID, you do it one of 2 ways. If you were actively sick, I want a viral load. But if you were just trying to find out if you ever had COVID or if you have antibodies for COVID, then that's an antibody test. Okay, next slide. So like I said, the big question in the room, elephant in the room, however you want to say it, is how long does vaccine protection last? And to be honest, we don't know. As you saw, the booster shot for Pfizer is out now, just because we've learned that that percentage starts to dwindle a little bit after about 6 months, which is why they did the 6-month rule. But at the same time, it doesn't dwindle enough to require everyone to re-get vaccinated. It's just maybe that immunocompromised individual who already has an immune system that is less active than, say, that perfectly healthy individual. So those are the ones we target now. But again, this is going to be ongoing, probably for the next couple of years. We won't really know the answer to that question. We like to use the example that when the polio vaccine came out, everyone, rushed to get polio because, again, you didn't have social media, you didn't have the news flashing it like we do COVID today. But the polio vaccine, actually, no one truly understood it till 10 years after the vaccine had started and given it. And when I say truly understood, I mean, we knew how it worked, we knew it was effective, but we truly didn't understand how long was it going to protect for. And that's going to be something that's going to be a longevity thing. So these are studies that, hospitals, your bigger institutions are going to be looking at just for the long term. So hopefully when that question is answered 5 to 10 years from now, COVID will probably be another thing on the vaccination card that we'll be used to by then, but we'll see. So next slide. So in closing, just reiterating some facts, COVID vaccine has been shown to be safe and effective. We have already given almost 400 million doses just from last December up until this September. And that's a lot of doses, especially in comparison to looking at the case averages, especially month to month. We are down about 75% versus where we were at the beginning of the pandemic, especially when you look at those higher hit areas, New York, at one point California, even Mississippi and Tennessee, we had started getting high. But then again, you also have to take that with a grain of salt, because then you have to compare it to vaccination rates per state as well. In Mississippi, we're only about 43% vaccinated right now. And I know y'all are in Tennessee. I think y'all are about a little over 50. If I'm not mistaken, y'all are like right above us. But correct me if I'm wrong. And compared to like California now, which is like 78% vaccinated. So, you know, you have to look at the rates and the vaccinations at the same time. And then just, we know that the vaccine itself not only protects us as individuals against severe disease, but also as a whole in regards to the Delta variant, because that's been the most contagious one. That's the one that's taken out majority of the cases that we see now in the United States. And then breakthrough cases, we know that those have been few and far-fetched in the fully vaccinated individuals. And then we know that they happen and they tend to be very mild if you have a full vaccination status. And if you are, like I said, fully vaccinated and you become infected with Delta variant, you can still spread the virus to others. That's where the whole masking and still protecting others, keeping your distance, the 6 feet, washing your hands comes into play, because mask is not just for yourself, it's for the protection of others. And then we know, again, people with immune weakened systems, we are now looking at booster shots, which again, only Pfizer is doing them right now, 6 months post your second shot, and for fully vaccinated individuals. So those people, again, we know their immune system is already not at its greatest, not at 100%. And we know we will never really get them to 100%, but if we can keep their vaccination status, their antibodies working, then that kind of decreases their amount. So my references, next slide, everything comes from the CDC. All those numbers you can easily access on your own. The state data I was kind of giving you was stuff that we get as physicians here to our email on a daily basis. And feel free, I know health departments in every state have to keep up with it. That is a requirement by federal government in regards to COVID. So you are more than welcome. If you go to the CDC, there's a link on the COVID website where you can put your state in and you can see your statistics as well. And then last slide, questions, comments, concerns. That was actually a picture of me today getting my booster shot, which turned out fine. My arm's pretty sore right now, but that's happened with all of them. But yeah, so as a healthcare worker, I decided to go ahead and kind of boost myself up, just because clearly I'm around babies right now who can't be protected. So that is the end. I hope I didn't go too fast or too slow, or that y'all learned something. Questions, comments, concerns? I'm an open book about anything, whether it's COVID, medicine.
Dr. Brown, I do have one question.
Yes.
For the booster, how far is that supposed to boost? Is that something that'll give us an additional 6 months of protection, or how long exactly is that supposed to boost it?
So right now, a booster is supposed to give you up to an additional full 90 days of protection. But again, it goes back to that question, is we don't know. And I think a lot of the we don't know process is because we haven't reached that full year mark in regards to how long the vaccine has been out. So vaccine wasn't fully approved until the end of November. So until we get to November, the FDA says they won't release long-term statistics until there's a full 365 days worth of information. And I say that prefacing that does not mean we don't know the vaccines work. That just means we don't know the longevity of them. But the hope for the booster is at least an additional 90 days, but we're hoping for more, especially since you've already had a 2-shot series prior. Did that answer your question?
Yes, it does. Thank you.
You're welcome. Any other questions? I see something in the chat. I don't know if that's a question. Oh.
Dr. Brown, I have one. Could you let folks know if they were to get the vaccine, just what can they prepare themselves for as far as side effects, or what's normal for them to experience, so they can have an idea of what to prepare for?
Yes. So the day of, we actually, as healthcare providers, we say you should probably pop like a Tylenol, ibuprofen, some type of inflammatory relief at least an hour before, just because this is going to be an immune response. So like I said, you're going to expect at the injection site, sore arm, pain, maybe some swelling. Some people have redness, just your usual getting a shot references. And then the next thing is 24 to 48 hours. So I'm going to speak on Pfizer only because that's the one we give at our health institution majority, and that's the one we've kind of seen where we know what kind of happens. So with Pfizer, with the first shot, we've shown that it's more just the arm soreness and lethargy, so tired. We tell our patients, you're going to be tired, maybe the next day not be like a hard day. So we actually suggest to some of our patients you get it on a Friday. That way you have kind of Saturday to kind of chill, cool off, unless you're, or whatever your next day off is. I'm not going to say Saturday because I can't assume everyone works Monday through Friday, but we do say for the first shot, expect to be tired and expect your arm to be really sore. We have come to find that the second shot is where that flu-like illness comes into play. So that's where we hear a lot of the patients say, oh, I had a headache, I was nauseated, a little bit of vomiting, I may have had chills, a fever. And when we say fever, a normal, I'm not going to say normal because fever is never normal. Let me choose my words correctly. A temperature up to 101 is a normal response. Does that make sense? So if you get up to 101, that's something I kind of expected because your body is growing an immune response. It's when you tell me your temperature is 101 and above, that's where I say, okay, we may have a higher immune response or there's something going on. So for my patients, if they come to me, I say very specifically after your second shot, if your temperature is 101 and lower, that is normal. Treat it, Tylenol, ibuprofen every 4 to 6 hours around the clock, it should come down. If it gets above 101, so 101.5 and above, that's when you need to call and we need to do something else. We may have to give you something a little more stronger. So when we say a little stronger in the peds world, that means we give you Tylenol with codeine because that's adding like a steroid on top of it. But the second shot is where we expect your immune response to kind of be more robust. And then with the booster shot, we are learning that the booster shot is equivalent to kind of the second shot. So we are expecting you to have that more flu-like illness again, maybe a lot more severity in the pain in the arm and the swelling, Tylenol around the clock if you do have that fever. So that's kind of the expectations. And from what I understand, Moderna is very similar, the same way. The only one I'm not fully aware of is Johnson & Johnson, just because, like I said, a lot of people don't get that one. I do know that I know maybe 2 to 3 individuals who did that said that theirs was the same thing, but it just happened all after the first shot since there's only one shot. So that's kind of the trajectory of what you would expect when you get the vaccine, the time frame. And again, within 48 hours, those symptoms should go away. And then we also worry about individuals. So I kind of didn't talk about this, but if you can't get the vaccine until 6 weeks post infection of COVID-19. So you can't get the vaccine and actively have an infection. You have to wait and get vaccinated 6 weeks after your infection period is over. Now, if you got infected with COVID and then you got antibody treatment, so y'all may have heard on the news, there's now an antibody treatment that you can get if you have severe symptoms with COVID. You cannot get vaccinated after that for about 3 to 4 months. It's greater than 90 days to get the vaccine. So those are special cases that we look at all time frames when it comes to when you come to the hospital, when you tested positive and whatnot. And those things are kind of on a totally different spectrum. We have to then, okay, this is when you were infected. This is when you can now get the shot. This is our time frame. Does that answer your question?
Yes, it does. Thank you. And it kind of brought up as you were talking another one. So another question folks will come into the health center and ask is, we keep track of course, immunizations and all other kind of vaccines you have to get to come to college, things like that. Can you get the COVID vaccine when you've had another vaccine in close in proximity? Should we wait a certain amount of time? Things like that.
So as an institution, we have decided that you can't get the COVID vaccine within 2 weeks of another vaccine. So the big thing now is people are getting flu shots. So we actually don't do them simultaneously. There has to be a 14-day time span difference. And that has actually been a new thing in the news now because, now that COVID's a part of the vaccine plan, what's our plan in regards to can you give it? When can you give it? But our institution has decided that 14 days, and I think that's kind of across the board for some of your bigger places. Just because if you do have a side effect, we kind of know which one to get it from, that kind of stuff. So we ask that there be a 14-day difference in regards to when you get vaccinated. Another thing that I need to mention, with it being a 2-shot series, if you miss the second dose, so I talk about the 21 and the 28 days apart. In regards to missing it, let's just say it's been now 40 days, you can get it up to 6 weeks post first dose. And after that, then you have to speak with your healthcare provider, because then you need to restart the whole series. We've only had that happen a couple of times with some patients, because in Mississippi, we deal with a lot of patients in the rural areas, and a lot of times at the beginning, especially of the pandemic, the vaccine was only available at certain places. So it was kind of hard for them to come get the vaccine and schedule it. So it has to be within at least 42 to 45 days if you want to keep within your series. But if it's beyond the 45 days between the first and second shot, then you do have to restart the series.
Thank you.
You're welcome.
All right, you all, are there any more questions that we may have? Well, Dr. Brown, I'd like to thank you on behalf of SWAB for coming and taking your time out to speak with us. And to the audience, I hope you guys learned a little something about the vaccinations. I will drop Dr. Brown's email in the chat for you all if you guys do have any questions for her. And that concludes it. I don't have anything else. If Miss Brittany, if you have anything,
I think that's it. Again, I'll just echo Erica. Thank you all for being here. Thank you all for your time. And I hope you did learn something. We will be taking this link in the recording and adding it to our Student Health and Counseling YouTube page, and also SWAB's information. Dr. Brown, thank you again for your time. If you would please check your email for a little thank you gift from us, just for your time and being able to be here with us.
Yeah, well, I enjoyed it. This made me relearn some stuff myself.
Yeah. I got it. I got it. Well, thank you all. That's all we have for this evening. Be sure to check our socials for the next event, and we'll see you next time.
Well, thank y'all for having me. Y'all have a good evening.
Thank y'all so much. Have a great night.